Hey there, I'm so glad you've joined me today. I am a senior pelvic floor physiotherapist over at OVA Women's Health. And in this explainer, we're diving into a really crucial topic that touches so many expectant mothers, managing pelvic girdle pain during pregnancy. If you're sitting there right now feeling some unexpected, maybe even scary physical discomfort, just take a deep breath. I promise we're going to break down exactly what's happening with your body right now, and more importantly, how we can actually support it.
Nobody warned me my body would feel this different during pregnancy. I literally hear some version of this almost every single day in my clinic. And if that resonates with you, I just want to validate exactly how you're feeling right now. It can be so incredibly overwhelming when your body is changing this fast. But I need you to know right off the bat, you're absolutely not alone in feeling this way.
Okay, so let's put a clear name to what you might be experiencing. We call it pelvic girdle pain, or PGP for short. Basically, it's discomfort originating from the joints, ligaments, and muscles that support your pelvis. And having a name for it, it really matters. Because this is a very real, very physical condition. Your pain is valid, and it has a clear structural source that we can absolutely work with.
So, what does this actually look like in your day-to-day life? Well, you might be noticing this deep, heavy ache in your lower back, your hips, or even your groin. Sometimes that pain might even radiate right down your thighs. Honestly, a lot of women first notice it as this sharp little twinge when they try to turn over in bed at night. Or, you might feel a sudden spike of discomfort just doing something as simple as climbing the stairs. Now, the absolute most common question I get from my patients is pelvic girdle pain normal during pregnancy? And here's the honest truth. It is incredibly common. But, and this is a big but, common does not mean it's just normal pain that you have to endure. You absolutely do not have to just grit your teeth and push through this. It's not a mandatory tax for growing a baby.
Part 2, the why. Let's quickly break down the actual physical changes happening inside your body. So one of the main drivers of all these changes is a hormone called relaxin. It has a very specific, totally vital job. It actually softens the ligaments that support your pelvis. This is how your body beautifully prepares to make physical space for childbirth. It's an absolutely brilliant natural mechanism. But that same softening can temporarily increase laxity, and that's what creates that kind of wobbly feeling of instability in your joints.
But it's not just the relaxin. There are a few other structural things going on. First off, your growing uterus is naturally increasing the mechanical load on your pelvis. Makes sense, right? Second, your posture is shifting to accommodate your growing baby, which entirely changes how your weight is distributed. And third, if you had any pre-existing muscle or joint issues before pregnancy, they might just be resurfacing now under all this new physical demand. If any of this is sounding familiar, definitely save this explainer and stick with me, because this next part is what really matters. How can pelvic floor physiotherapy actually safely help you? At specialized clinics like ours at OVA Women's Health, we completely shift the narrative. We move away from just telling you why it hurts, and we actively create evidence-based, customized relief strategies specifically for your body. And that all starts with a comprehensive assessment. We don't just hand out generic advice. We actually look really closely at your pelvic alignment and your core stability. We assess the mobility of your hips and your sacroiliac or SI joints. We map out your unique postural changes so we can pinpoint the exact, precise root of your specific pain. Once we've got that map, we move right into targeted relief. A huge piece of this puzzle is deep core activation. We focus specifically on a muscle called your transversus abdominis. You can kind of think of it as your body's built-in corset. By learning safe, tailored exercises to actually engage this deep core wrap, we can dramatically improve your pelvic stability, and that significantly reduces all that mechanical strain on your joints. Another really powerful tool in our toolbox is hands-on manual therapy. And yes, let me reassure you right now, this is completely safe and incredibly gentle during pregnancy. We use targeted soft tissue release, myofascial techniques, and very gentle sacroiliac joint mobilization. These hands-on approaches are amazing for relieving muscle tension and helping you get back to comfortable, fluid movement.
Now, you might be wondering, okay, but will I need to buy and wear one of those support belts? It's a fantastic question. Support belts and specialized taping can be amazing tools. They can literally give your pelvis a comforting hug when things feel a bit too unstable. But they aren't mandatory for everyone. That personalized plan we talked about, that's what will determine the precise physical support that's going to work best for your unique body. For years, the old advice was all about these unnecessary restrictions, just a long, depressing list of things you shouldn't do. Our approach is entirely about moving safely with confidence. For example, instead of telling you to just avoid the car altogether, we teach you simple little tweaks, like keeping your knees together when you swivel out of the seat, that can literally eliminate the pain entirely. At OVA Women's Health Physiotherapy in Burnaby, BC, this is our absolute core specialty. We are your local, dedicated partners in this journey. We're fully equipped with advanced expertise, specifically in pregnancy-related pelvic pain. We aren't going to brush off your pain as just part of being pregnant. We take your discomfort seriously, and we have the training to actually, truly help you. So, what is the OVA difference? First, we build highly individualized care plans. We take a whole-body approach to your pelvic stability, looking at how everything connects together. Our appointments are unhurried, they're completely private, and most importantly, we provide a compassionate, judgment-free space where you are always listened to and you are always believed. I really want to leave you with this final, vital thought. You deserve to feel supported in your pregnancy, not just told it's normal. Pregnancy pain can be deeply exhausting, but you absolutely deserve to feel physically comfortable in your changing body. Safe, expert help is readily available to you right now. You really did not have to navigate this alone. Please grab your phone and use the QR code right here to take that first step toward lasting pelvic health and book your welcoming, supportive first appointment with us. Ask yourself, are you ready to stop just enduring your pregnancy and start truly experiencing it? Your body is doing incredible work right now. Let's give it the support it actually deserves.